$250,000 came in via the Bonnyvile Health Foundation Gala. It's the social function of the season for partygoers, but also an evening that can define the next year in healthcare for all residents. On Around the Region tonight, we bring you to an evening in the Orient. This is Bonnyvile's 14th Health Foundation Gala. There are over 600 tickets sold and almost 100 donated items up for auction. They were hoping for $200,000, but in the end, the community upped that by another $50 grand. Every year, this night gets bigger and better, and with it, so does Bonnyvile's level of health care.
It improves the kind of care and the kind of services that we can provide. And we provide services not only to the population of Bonnyvile, but we provide services for the wide range, the people that work at the oil companies and the transient people. So it's greatly needed.
This year, the money raised is being split between two departments. Health officials identify the greatest level of need.
It'll mean a lot for people that have hearing disorders, because we will be purchasing an audiogram to start a new health earring clinic, which is just wonderful for this area. And then we will be upgrading OR equipment, which is very important in this area. As you know, we support a lot of trauma, and upgrading our OR equipment is incredibly important to the staff and to our patients.
Ear, nose, and throat specialists, or ENTs, are few and far between. Here in Bonnyvile, they're nowhere to be found. Patients have to drive to Edmonton for this specialized care.
We're hoping that at least 50% of the people that currently have to go to an audiologist will be screened out now and get to take a different route more locally. And that saves them driving up and down the highway. So that's a very important piece of work that we're going to be able to do. Those that do have to go forward will have a much more specialized diagnosis, so we will know exactly where they need to go.
This is just the latest in a long list of extras these residents have rallied to purchase. Things like specialized beds and better equipment for doctors are causes these residents are coming together for. The doctors are also able to use the donated money as supplementary funding to improve equipment.
We were approved for certain x-ray equipment, but in one of the galas with the funds we raised, we were able to take that x-ray equipment and bring it up to the next level. So we're able to do specialized x-rays, because the gala put in another $100,000 that let us get the the really good equipment instead of the basic equipment.
Guy has been at the Bonnyvile Hospital for 25 years. He's seen the landscape of healthcare change largely because of the Health Foundation.
When I arrived, we were doing just a few basic surgeries, tonsillectomies, some dental work. We had no scopes. We really didn't have any visiting specialists at all.
Now they've been able to recruit more family doctors who are also specialists. Palliative care, orthopedic surgeons, and anesthesia specialists have been added to their list of staff. There's also 3 GPs who operate the local cancer clinic, so patients can undergo chemotherapy right here in Bonnyvile.
So we're able to provide a lot of these specialty services, bring them out from the city to the patients instead of the patients always having to go to the city.
Of course, that stabilizes your population. It stabilizes health. And that's really what healthcare should be all about in the future. It's about that health promotion and being able to meet people at front where they need the wellness or the lower level assistance to be able to stay healthy and stay in their communities longer.
That's why health foundations started popping up across Canada. This one was established in 1997.
It's the new reality, with healthcare funding changes, that if we want to enhance healthcare, then we have to roll up our sleeves and get to work, and we've been doing that for 15 years.
But organizations that bring in thousands of dollars every year rely on citizens who want to invest in their health care and the care of others.
In 14 galas, we've had 14 sellouts, with long waiting lists of people still hoping to get tickets. And as far as the silent auction items, I think we've got close to 100 this year, and people are very generous in their support, have been from day one. And it's a real credit to the community of Bonnyvile on how they come out and support what is a very good cause.
This community absolutely blows me away. The people, the support that they have for their hospital and the work that we do here is amazing. And I think that just speaks to the people and their generosity in this community. And we're very, very pleased and very, very thankful for all they do for us in this community.
And every year the support for it is it's grown tenfold. If you don't get your tickets early enough, you just don't get to go. This is definitely the highlight of the year here in Bonnyvile, and they do a fabulous job.
Lesky was crediting the 14-person gala committee in its hard work to put on the party, but they're not in it for the glory. This night is all about the people behind healthcare. Currently, Lesky is working to better the health system in the region. She's trying to define the role of the nurse practitioner in the primary care network and fighting for more rural PCN funding. And, like doctors and donors alike, she doesn't have to look far to find her motivation.
It warms your heart to know that the community gets together to support a very important institution within our community, which is our hospital.
Coming up, this story is off the rack. Lashburn's mayor hails the title of North American Scrabble champion. We go into his world next on Around the Region.